Collier, good morning.
Good morning, Rickey, Smiley. Happy Monday after Thanksgiving. I'm telling you, a lot of people did not listen to the CDC, and they did their traveling, and they were amongst their groups. But their biggest risk for exposure was during the actual travel period, particularly public transportation such as buses, transportation at the airport, getting you from one concourse to another, and the airport environment proper. Even though the plane trip is actually not considered too high risk of venture, it's getting into the plane. And the period, that short period of time when you're standing up trying to load and get into your seat, that's the biggest exposure period at the airport that people have had.
Really?
So, Dr. Birch, yes, sir. Dr. Birch, that's the coronavirus task force leader, said, assume that you have been affected if you traveled over Thanksgiving. And if you should be tested within the next 5 to 10 days. But if you're older than 65 and you have any comorbid conditions such as diabetes, high blood pressure, etc., you should be tested immediately and then get retested, particularly if you're developing any symptoms, because you're at risk. So one of the things that happened since the last time we spoke, Rickey, is that the FDA now has given authorization for home-based testing. There's a new test that's saliva-based, and it requires you basically just spit into a collection device, a cup, versus submitting a swab, which is much more comfortable. And because a person can independently spit into a cup, the saliva test does not require interaction with a healthcare worker, so you don't have to go to a testing site or to the doctor's office. You can do it at home. This also cuts down and saves money on PPE, such as masks, gloves, gowns that the person doing the test needs. So both the saliva test and the nasal swab work by detecting genetic material from the coronavirus. Of course, the nasal swab, particularly the PCE, preliminary chain reaction test, is the most potent. But the saliva test is good enough, I guess, for home testing and under those circumstances versus no testing. Both tests can have false negative results, but most people, if you get a positive, you can assume that you are positive. So they also have developed a home nasal swab, Rickey. This one, though, you just use in the lower nasal. You just basically wipe the inside of your nose. Right. And I don't particularly care for that test because that's not where the virus usually is. But, again, if it comes out positive, then you can pretty much presume that you are positive. So, in summary, if you traveled over the weekend, consider that you probably are exposed, have been exposed, and that you now have the virus, and just get yourself checked. Boost your immune system, of course, is the number one way to treat this. So, as always, take your vitamin D, 5,000 international units per day, your vitamin C, 1,000 milligrams per day, and your zinc, up to 50 milligrams per day. And remember, we are still in the pandemic, so wash your hands, wear your mask, and watch your distance. Rickey, as always, these opinions expressed are those of Dr. M.J. Collier, not those of the Rickey Smiley Morning Show or its radio affiliates.
Hey, Dr. Collier.
Yes, sir.
Hey, run that vitamins bomb one more time, Dr. Collier. It's so important. Okay. People don't understand. And tell them why.
Because your immune system is your only therapy that we have right now other than taking the antibody infusion test, which is going to be very, very expensive. So boost your immune system. Vitamin D has the most important boost in your immune system. It gives you immediate response, as does zinc. After literally the very first tablet, your immune system is boosted. And your immune system fighting it, that is the whole basis of the vaccine. So instead of taking the vaccine, make your immune system work the way that it's supposed to work. The science of immunology has not changed. We are where we have been over hundreds of years, and why the human species survives in the world right now, because our immune systems adapt and fight off bacterial, viral, and fungal infections all day, every day. So you just want your immune system to be boosted and work at its optimum. And to do that, you add some supplements such as vitamin D, because 90% of the population is vitamin D deficient, particularly African Americans. We don't know why, that we just are. But when they found, as we noted previously, that people with low vitamin D had worse infections, were hospitalized more often, and had higher rates of poor outcomes like death, because of a simple fact that their vitamin D was too low. So that's the elegant solution for this. It's inexpensive. Everybody can get it. Go to my website, lipodrops.com, and find out how you can boost your immune system. LIPODROPS.com.
There it is, y'all, the one and only. Go on, did you do your disclosure?
I did, but I do it again. These opinions expressed are those of Dr. M.J. Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show, or its radio affiliate. Hope you had a wonderful Thanksgiving, Rickey, and all the Morning Show crew.